welcome to Pet Talk, where we're talking to people talking about pets. My name's Michael Dr. T. Tequila, and I have with me Dr. Lisa Fink, who now works at the Cornell University Veterinary Specialist Center. You are in Stamford, Connecticut. Is that correct, Lisa?
Yes, I'm in Stamford, Connecticut.
Awesome. Thanks for joining me tonight. And what we're going to do is we're going to just have a little snippet. We're going to talk about what's involved. So Lisa is a veterinarian dentist, and she's a specialist. So why don't you just tell our viewing audiences what's involved in becoming a specialist?
All right. Well, after veterinary school, oftentimes people do an internship, and so I did a 1-year rotating internship in small animal medicine and surgery at the Animal Medical Center in New York. And then I was in general practice for a couple of years, and I decided I wanted to specialize in dentistry and oral surgery. So then I did a 3-year residency at the University of Pennsylvania, the veterinary school, and all I do is teeth. So for 3 years, all we do is tooth extractions, root canals, jaw fractures, anything and everything to do with the mouth and the face. I am trained in. So that's all I do now.
And you love it, right?
I love it.
Okay, so for our viewing audience out there, I'm considered what's called a general practitioner, and general practitioners can actually do dental. We call it dental prophy. So we're really good at actually the similar things your dentist can do, where we go in there, we take x-rays of your teeth, we actually clean your teeth, we can do extractions and some minor surgery, but the difference between what I can do and what Dr. Fink can do it's quite vast. And why don't we come up with just a few things that a veterinary dental specialist can do versus your regular veterinarian?
All right. Well, I have had some extensive training in saving teeth. So definitely, oftentimes the choice to extract, by the time I see the tooth, a lot of times that is unfortunately the choice when there's greater than 50% bone loss, or the fracture of a tooth is at the level of the gum line. But in certain situations, we can actually salvage a tooth, either with root canal therapy or vital pulp therapy, or other advanced periodontal surgeries using special gum flaps, bone grafts, and other techniques. And those things are not taught in veterinary school and are learned during specialized training.
And what a lot of people don't realize is that they're just thinking the actual teeth themselves, but you are, what's involved in that oral cavity. There's a lot of soft tissue there. There's a lot of bone there, and so you can do more advanced oral cancer surgeries, etc. Right?
Yes, so I can do jaw resections for oral cancers. I can repair oronasal fistulas that might happen if a dog loses a canine tooth or any tooth on the upper jaw. I can repair traumatic cleft palates, congenital cleft palates to a certain degree, and a lot of head trauma, facial trauma, jaw fractures. Basically anything that happens, dog gets run over in the driveway. I had that this week. We can do that.
And that's why we're doing the thing tonight, right? Because you had that emergency. We were supposed to record this earlier.
Yes, I was supposed to do that last week, but I had a dog that was run over in its driveway. So
that's completely legitimate. That's completely legitimate.
So yeah, there's lots of things that we can do, advanced things, and also something that's out online now. If people are on Facebook, I'm sure there's a picture circulating of a golden retriever with braces. I'm sure you've seen that.
Yes, he's smiling, and it looks so cute. It looks so cool. Yeah.
It looks really cool, but we can do orthodontic procedures on young animals, but the goal is, of course, to just have them have a comfortable and functional bite. So not just to make them have a perfect smile, but to have a functional bite and be able to be comfortable, because some animals are born with problems, just like people, where their teeth aren't perfectly straight, or they have a lower jaw that's too short or a lower jaw that's too long, if you think of like a bulldog. And there are certain procedures that we can do to help an animal be more comfortable so that its teeth aren't traumatizing the soft tissue.
And so, and many of these things are things that we as pet owners cannot prevent, so to speak. A lot of the things that your regular practitioners, such as myself, a lot of the dental issues come in because just regular dental care isn't happening. So if you need that specialty care, definitely, reach out to your regular vet. Chances are they have a friend or someone they know in a specialty center like where Dr. Fink is, where they can just call them up and say, listen, this is what I have going on, and refer you to that. So thanks a lot, Lisa. How can people reach you? What's the website of where you're at?
The website is www.cuvs.org, and I'm always happy to talk to any referring veterinarians. I get calls all the time, and people send me x-rays with questions and things like that, and I'm always happy to chat.
That's great. And it's funny because I was just talking to you about a case before we even did this segment, and because it's something that I've never seen in practice, and my associate is never seen it as well. So I told everyone that I'd be talking to you tonight. I said I would ask you about that. So it's just wonderful. Well, thanks so much, Lisa.
Yeah, no problem.
Okay, take care.
Thanks.